Let's face it, the transition from the classroom to the clinic, it's brutal. There is this unspoken belief in nursing education that once you got the theory down, everything should just be, well, a click in real life. Isn't that right? The reality is theory and practice feels like they belong in two different worlds, and many of us find ourselves lost standing in the clinical setting trying to figure out why the textbook didn't prepare us for the chaos of real life patients, real emergencies and real decisions. This episode is about that gap. How do you take what you've learned in a classroom and turn it into something that works where there is a patient in front of you? Hello there, my name is Martin. I'm a nurse with over 20 years in the healthcare sector in different roles, and I have even helped educate new nurses. So let's dive right into the topic. When I was fresh out of nursing school, I was confident that my years of hard work memorizing procedures, protocols, and pathophysiology, even psychopathology, would make me more than ready for the clinical environment. But my very first shift on the floor showed me how wrong I was. I'll never forget the moment a senior nurse asked me to assess a patient who was rapidly deteriorating. I froze, feeling overwhelmed by the clinical signs, the machines that just kept beeping, and the real weight of responsibility on my shoulders. I had the knowledge for sure, but what I really lacked was the application of that knowledge under pressure, and that's something the classroom didn't prepare me for. The truth is, theory equips us with the most essential knowledge, but it's only half the battle. Because the clinical settings are more dynamic, unpredictable, and demanding more than just the ability to recite a textbook definition. It's like learning to swim on dry land. You understand the mechanism, but until you are thrown into the deep end, you don't know how to stay afloat. So how do we bridge that gap? It starts with recognizing that learning doesn't stop when you graduate. In fact, that's when the real learning begins. Every clinical scenario is an opportunity to build on the foundation of theory, but more importantly, to adapt the theory to reality. Let's take communication with patient as an example. In school, we are taught the fundamental of therapeutic communication, open-ended questions, empathy, and active listening. But when you are in a busy emergency department and your patient is in severe pain or confused, these techniques need to be adapted on the spot. I remember an elderly man, disoriented in distress, who came in to the ER. According to theory, I should have been calm, patient, and used clear communication techniques. But it was the noise, the urgency of the situation, and his fear that took over. My theory was no match for the complexity of his lived experiences. So what did help? The adaptability I learned from working alongside experienced nurses, watching how they bend the rules of theory without breaking them. That's where the magic happens. In those little tricks you learn on the job. It is what textbooks can't possibly prepare you for. And this brings me to an important lesson: mentorship. The best way to turn theory into practice is by observing those who have done it before you. When I was starting out, I shadowed a senior nurse who had been working in the ER for over a decade. She could assess a critical situation and know exactly what to prioritize. I asked her once, "How do you know what to do when the theory doesn't seem to fit the situation?" Her response was simple: experience. But you'll get there by staying curious, asking questions, and never being afraid to admit you don't know something. This advice stuck with me, that it's okay not to know everything. In fact, embrace the unknown can actually make you a better nurse. And the curiosity, the want to know the unknown, and admitting I don't know it is what started this channel, because only by admitting that I don't know something, I try to figure it out, I can make a video about it. When I can explain it to you, I have learned it. So my learning benefits you, but let's get back on track. And if you like this video, remember to click subscribe and that bell notification icon so you get notified every time I upload a new video. And the key to curiosity is to be proactive in seeking guidance. Whether that's from mentors, colleagues, or even other healthcare professionals, like doctors or therapists. These interactions allows you to refine the theory you've learned into something practical and adaptable to real-world scenarios. I once had a situation where a patient came in with what seemed like a straightforward case of chest pain. Based on theory, I immediately thought of myocardial infarction or angina pectoris, and my mind raced through the possible interventions: ECG, nitroglycerin, oxygen therapy, but something about the patient's presentation didn't add up. Their history, the way they described the pain, and some subtle clinical signs pointed me in a different direction. I consulted with the attending physician, and as it turned out, the patient has an aortic aneurysm, something I hadn't even considered because I was so focused on my textbook checklist. That moment was a wake-up call. Theory gives you a framework, but in the clinical setting, you need to go beyond the framework. You must think critically, assess holistically, and always be ready to adjust based on the specifics of the patient in front of you. And that leaves us with clinical judgment. It isn't something that comes overnight. It is built through trial and error, observation and reflection. Early in my career, I used to second guess myself constantly. I'd assess a patient and immediately wonder if I'd miss something or misinterpret the symptoms. But over time, as I became more comfortable applying the knowledge I had in real-world situations, I learned to trust myself more. I remember a shift where we had a patient who seemed stable but had an unsettling feeling about them. The vitals were within the normal range, the lab results were pending, and everything seemed fine according to theory. But something in the way the patient looked and the gut feeling I had from previous experiences made me stay alert. A few hours later, the patient crashes. I was glad I stayed close, ready to act, and I realized that trusting my instincts, backed by my experiences, was just as crucial as relying on theory. Bridging the gap isn't about perfection, it's about progress. Here's the thing, no one expects you to be perfect. Bridging theory and practice is a process, not a destination. The goal isn't to flawlessly apply every piece of classroom learning to every clinical scenario. It's about the flexibility, adaptability, and open to continuous learning that you need to be aware of. Every shift is an opportunity to refine your skill, to merge the theoretical knowledge you've gained with the practical realities of patient care. What I've learned from many years in nursing is that bridging the gap between theory and practice isn't about mastering one or the other. It's about learning to dance between both. And one of the ways I dance between both is by knowing a lot about nursing, and you can get smart on nursing in this video right there, YouTube things you will like. And I'll be seeing you right over there. I'm looking forward to teaching you something more about nursing, healthcare, and how we can adapt it to our practice. So I'll be seeing you right over there.